DHEC issued a warning today about the dangerous surge in respiratory illnesses across the state. These illnesses include the flu, RSV, and COVID-19. DHEC says the flu season started early this year with cases rapidly growing. For instance, the Lexington Medical Center says they are seeing an average of 100 positive flu cases a day. Meanwhile, MUSC says they're seeing a high number of people hospitalized with RSV. Dr. Allison Eckert, Chief of Pediatric Infectious Diseases at MUSC's Children's Hospital, has more on what parents need to be looking out for.
I personally think that it has a lot to do with children going back to school. So all of these viruses circulate in usually a seasonal capacity that we're used to. RSV peaks usually in January and February. Flu is a little bit variable, but this is very early for influenza this year. And it's a perfect storm of people thinking the pandemic is over and going back to their usual behavior all at the same time with the start of school.
Doctors say the most vulnerable to these viruses are infants, young children, and those with underlying medical conditions. Seniors are also at high risk for flu and COVID complications. DHEC says there are things you can do to reduce the impact of these illnesses, beginning with washing your hands often, covering your cough or sneeze, and wearing a mask if you are at risk. Some say to stay home and away from others when you're feeling ill and get vaccinated for the flu and COVID-19. And DHEC is reminding you that COVID-19 continues to spread, and it is still a serious illness in South Carolina. Numbers released show that there were 3,459 new cases last week. 235 hospital patients were positive for COVID-19, and 6 more South Carolinians died last week from COVID-19 complications. The percent positive rate stands at 10.8%.